Looks weather forecast from the Giant FM Weather Center. I'm Randy Wynn.
9:07 on the morning show, 9 o'clock hour, typically on Friday mornings, means Chamber Chat. And this is one of those Fridays. The executive director of the Shelby County Chamber of Commerce is Courtney Chappella. Good morning, Courtney.
Morning, Johnny. How are you?
Doing well. Got a long road trip. Take the kid back to college today.
My kids went back to school this week, so they're not with me this morning. They've been here for several weeks.
It's remarkably quiet out in the lobby.
They were pretty quiet out there because they had their tablets, but, you know.
Well, let's not be so quiet in here. You got guests? Who'd you bring?
Well, this morning I have MHP. They're going to be talking about the Healing Hustle. Good morning.
Good morning.
Would you like to introduce yourselves first?
Yeah, my name is Crystal Barnard. I'm the Director of Wound Care Services at Major Hospital.
I'm Shelby Hudson. I'm the occupational therapist that works inside the wound center.
Welcome to you both. For listeners who may not know about or just hearing about the Healing Hustle for the first time, can you tell us what it is?
Yeah, so this is the 6th year that we're hosting this. It's a 5K. It's open to everybody, runners, walkers. You can bring strollers if you'd like. It starts at the YMCA, and the trail features the MHP campus, and then it ends at the YMCA. It can be a family event, or you can come out and try to get a PR. After the adult 5K, we have what's called the fun run, so it's for kids 12 and under. They run around the YMCA. It's a quarter mile. This is honestly like the best part of the race. It's super fun. This year I'm actually in charge of the fun run, so we're gonna try to do a theme this year. It's gonna be superhero theme, so we encourage like all the participants to come out and dress as their favorite superhero, and I'm working on getting some of Shelby County superheroes in the race too, with Shelby County police officers, the city police officers, and hopefully some firefighters as well.
Very nice. I'm sure there'll be some great pictures to come out of that of the little kids running in their superhero costumes. So how did this event get its name?
So the event got its name, the Healing Hustle. It's kind of a catchy phrase that represents the work that is done inside the wound center. And the phrase was actually created by all the team members in the wound center, but it kind of focuses on what our goal is to try to heal all the patients that walk inside our doors. And it also represents that the funds that we raise from this race go directly back to our patients. And we use those funds to address barriers that might be preventing them to heal, or just really being a barrier to their overall health. The symbol or the logo for the run that is on the t-shirts, the flyers, the hand, that was a symbol that was created by one of our nurse practitioners, Lisa Castor's daughter, and that was actually created year one, so 6 years ago, and we all as a team have decided that we want to keep that logo for years to come.
Awesome. So what inspired MHP to create this, the Healing Hustle, and why is it so important for MHP?
So this is, you're exactly right. This is just so important. But what inspired us was 2020 was a really hard year for everyone. You know, COVID, a lot of uncertainty, and, you know, it impacted the healthcare team, but it more importantly impacted the patients. I don't know about the rest of you, but in hard times, I think that we kind of lose ourselves, or we try to lose ourselves in the ability of giving back. So I went to the team at the time and said, you know, this has been a hard year for all of us. I want to challenge you guys in something that we can give back. I gave them free reins to anything. It can be anything you want to give back to. Is it Scuffy? Is it that we want to give back to the Cancer Society? What it may be. They all expressed interest in giving back to our patients because we see the needs every single day. So we were able to immediately collaborate with the Hospital Foundation to create this event, and it's been so successful. We've been able to do it every year. So that's really why this is so important.
I think you've kind of led right into my next question. So this just isn't another 5K. What makes it unique compared to other community races?
I think it's because we all come together for a greater good. You know, I cannot tell you enough the impact that this money has on our patient population and our community. We utilize it every day to break down, like I said, those barriers of health, social determinants of health. So we may use it when a patient is expressing need, like they cannot afford their prescriptions. That's utilized a lot. We got Shelby here, and she'll speak more later about what she does, but compression stockings are very expensive for some patients and are not covered by insurance. Right. Insurance is getting harder and harder every day to navigate and try to get things covered. So we buy a lot of compression stockings, dressings in general, nutritional supplements. Nutrition is huge in our specialty, so nutritional supplements are expensive. We know that if you're trying to pick up even a protein drink at Walmart. So a lot of our monies go to that, but we've purchased groceries, we've purchased care packages for people in situations of domestic violence where they're leaving our office to go to their safe place. I know Shelby has been creative, and one of my favorite things that she's been able to tap into the foundation for is she was actually able to buy or help purchase a pair of overalls for a patient so he can continue to work but also keep his wraps that he needed for his legs up while he was working. So the benefit is huge. We use it every single day. I mean, every single week. And we need it now more so than ever before.
Absolutely. So let's talk a little bit about the details. I know that you mentioned them earlier, but when and where will this year's Healing Hustle take place?
So the Healing Hustle will take place on September 19th of this year. It's on a Saturday. You can pre-register by September 4th, and it's $25, and then day of registration is $30. It's going to start and finish at the YMCA, and then, like I said, the kids run will be one lap around the YMCA, which is about a quarter mile.
Perfect. Is this event, does it design for competitive runners, walkers, families?
Yeah, so we've had runners actually that are trying to get good times for Boston marathons or other, elite runs, or so they can get those times, and we all have the runners that are trying to get their personal best records at the front of the pack, and then the walkers obviously towards the back. But then, like Shelby said, we have families that come, they bring their strollers, they have it more of like a family day, and we've even had like a pack of ladies that have come back every year, and they kind of have it as their morning ladies' day out, or they just kind of stroll the MHP campus, laugh, have fun. So it's really for anybody.
So you mentioned registration. What's included with the registration?
Each runner will receive a t-shirt. We always have water and like different snacks for, after the race. The fun run, so the kids run, all participants will get a t-shirt, a ribbon, and a goodie bag.
Perfect. About how many participants are you hoping to have this year?
We've averaged between like 50 to 100, so we're hoping to bring in at least like around 75 participants. So.
Okay. And what would you guys say to someone who's never competed or completed a 5K before but's thinking about signing up?
Oh gosh. Okay, so coming from like a non-runner myself, it's not something that you have to go out and train for September 19th, but totally more than welcome to train. I would just go in with an open mind, like this is for fun. If you want a PR, do that goal mindset, go for that PR. But if you're just signing up, for fun, like a girls' day out, or just something that you've never done before, and this is something to check off the bucket list, just have fun with it. You're there for yourself, for a good time, for a good cause. So just go out and do it for you.
So if someone isn't able to participate and actually run or walk, are there volunteer or sponsorship opportunities available?
Absolutely. And I really don't know what we would do without our volunteers, our sponsors. Our volunteers, there's several volunteers that come back every year. A couple of our valet guys that work at our building, they come back every year. Janie Schuster from our volunteer services, she comes back every year. Some of the nurses up on the floor, they come back, and we really try to line that trail with volunteers that really pump the runners up. We give them, different hats, different necklaces, leis, and noisemakers. So they really do a good job. But our sponsors are huge. We really try to rely on sponsors that we deal with on a day-to-day basis. So those are the vendors that we work with that supply the items that we use to help heal wounds. And we really try to focus on that population because we don't want to take away from any of the foundation work that the hospital does with community partners. So some of our big vendors that come back every year are Prism. It's a company that we use to order wound care supplies that delivers right to home. Elite Med, they come back every year. We order a lot of lymphedema pumps from them for our patients. Central Brace, it's a company that works right in our office. They help us get diabetic shoes for patients, also different kinds of braces or offloading equipment. One of the biggest sponsors I think this year that has come through so far is Medtronic. They're our biggest sponsor so far. We're super excited about that. Suburban Home Care, Ashford Place. Those are just to name a few. And the other thing I want to mention is I want to say that almost every single one of our staff members sponsor the race in some way. And providers at the hospital, providers can work with Letitia and the foundation to actually donate their PDO back to the hospital. So our physicians in the hospital see so much value, and the ones that work with us see much value in what this fund does for us and what it does for our patients. So we've had a lot of those types of donations, but we couldn't make it happen without our sponsorship. And it's also an opportunity for those who sponsor us to get that marketing opportunity where we can really feature those collaborative relationships with our vendors. Their logos go on our t-shirts, they go on our signage, and we also give them shout outs obviously on social media.
You've mentioned the foundation several times, and I actually had Letitia on last week talking a lot about the capital campaign and the foundation. But how do you work together with the foundation to kind of disperse those funds that you raise?
So inside the foundation, the monies that we raise go into a pocket where it just goes back to, obviously, the patients in our building are the patients we serve. However, if there's any patient that needs money, like we would be generous in saying, hey, the cancer fund inside the foundation, they need X amount of money. Like if we had that money in ours, we would definitely shift it that way. We all work together, but Letitia really helps us, make sure that we're meeting those guidelines for fundraising. And there is a process with her that we do when we find a need. And she's such a great support person, and she's just always so proud when we are able to get our vendors to give back to our patients.
Absolutely. So we've talked a lot about the race and kind of the things that you can get use those funds for, but it benefits the Wound Center, really. Can you tell us about the services that the Wound Center provides?
Absolutely. So we offer a lot of different services that have, it's more, obviously, it's become more than just wounds. So we will treat any type of wound. You hear about diabetic ulcers. You may hear about venous or arterial ulcers, pressure ulcers. We also treat some traumatic wounds, minor burns. Any wound that's not healing, the big number is 4 weeks, but if you have any underlying condition like diabetes, you have any circulation issues, call us immediately. We can start taking care of those wounds, and we have different dressings, different modalities. We'll see these patients week to week and until they heal. We also offer, Shelby will, she'll talk about her services here in a second. We also offer ostomy care. So we have an ostomy nurse, and she will meet with these patients that have recently had an ostomy and really support them, get them different supplies. We've also added this past year an IR doctor, interventional radiologist doctor, who he really helps with our revascularization to the lower extremity. So we can't heal a wound if we don't have blood flow. Right. So he is huge with that. So there's some procedures that he can do in the office, but then there's some procedures that he does in the operating room and the procedure room. Like, these patients aren't completely out, which is great because they can get back to work, get going. And he offers some other services that aren't really related to wounds that helps patients that may have chronic knee pain, shoulder pain, plantar fasciitis. But he's been a great addition. We've been able to heal a lot more wounds because of having him on our service line.
I think, a lot of people will have a wound that may not be healing.
Yeah.
And they think, it'll eventually heal. When do you tell them, they should come in and see you all?
So the magic number, we say 4 weeks. However, if you're concerned, if that wound is showing signs of infection, redness, swelling, drainage, odor, and you have any underlying condition, or you've had a wound that keeps reopening, it heals and it reopens, call us, and we will get you in. And like I said, we see patients every week until they heal, and we actually have a healing bell once they do heal, and we get to celebrate with them. So that's what.
And your team takes a comprehensive approach to wound healing. What does that mean for patients?
So a comprehensive approach really starts day one. So day one, our nurses and providers are addressing the patient and looking for underlying causes that may be causing that wound. So if it's diabetes, they're making sure their blood sugar is under control. If it is some sort of circulation issue, we're making sure that, hey, are we getting them the services they need, maybe with Dr. Hallam, to reestablish blood flow. They're looking at nutrition day one. Nutrition is vital in our world. So we really try to step back, take a look at the bigger picture. We also look at swelling. That's where Shelby comes into play a lot, and helps us with any underlying swelling, edema or lymphedema, because if they're swollen, we're not going to heal. Right. So we really try to do that. But then I think something else that kind of this team does, and I really truly believe it's not a bias, is they really try to meet patients where they're at. Every day, try to celebrate some sort of win with them, or meet them out with their care plan. If they can only get their dressing changed twice a week, okay, we're going to try to come up with the best plan to where they could change their dressing twice a week. Right. Or transportation maybe is a barrier. We will come up with the best plan, and I really think that that helps quite a bit. Patients, if they're a few minutes late, it's okay. We're going to work you in. We're going to figure this out. Life gets in the way sometimes. So we really try to, like I said, meet the patient where they at, and I think that increases our success rates.
Absolutely. And you have some advanced treatments available, like the hyperbaric oxygen therapy. You want to talk a little bit about that?
Yeah, so we offer advanced modalities inside the wound center. So we have the hyperbaric oxygen chambers. It is a chamber where the patient will go in, and they are exposed to 100% oxygen at a depth of like a scuba diver would undersea. So the whole idea is to push that oxygen to that wound bed to kind of heal it from the inside out. The other advanced modalities that we offer are skin substitutes. They are like an advanced dressing that helps the body's natural abilities to heal on its own. We offer wound vac therapies for those patients that maybe have wounds that are producing a lot of drainage. And I would also want Shelby to kind of talk about what she does, because it is more an advanced treatment option for lymphedema and edema.
Yeah, so I'm a certified lymphedema therapist, and I help treat like the lymphedema at the wound center. Like she said, you can't really heal wounds if there's still a lot of fluid and like cellular buildup in there. So I work really close with the nurse practitioners there, especially if a person has swelling and wounds at the same time. We collaborate a lot. There's a lot of like inter-office collaboration there. And yeah, so I work on bandaging people. I do massage therapy as well. I really look at it from a holistic approach, like our whole office does. Nutrition, lifestyle, all of that really plays a big role into healing wounds and just, being healthier. So
absolutely. And one goal of the Wound Center is preventing hospitalization and even amputation. Mm-hmm. Why is early treatment so important?
So early treatment is so important because obviously the longer it's open, the more likely it is to become infected. And sometimes those infections can advance to your bone, which could be detrimental. And that is where amputations come into play. So we really try to get them in there and get treatment going, address any infection, try to stop that wound and heal that wound before it advances to the bone. Or if they have a circulation issue, address that sooner versus later, because if you lose all blood flow, you could also at risk for an amputation. So we really pride ourselves, and now with Dr. Hallam, we have Dr. Candela and our hyperbaric oxygen chambers. We truly have a limb preservation program, and we pride ourselves in that. And I think that any patient that has been in our chamber, we've either been a complete limb salvage or a partial limb salvage, where we thought they were going to have an amputation below the knee, but we only had to do an amputation like at the toe level or at the ankle level. So that's huge. And anytime that you start amputating, unfortunately your mortality rate goes up, your quality of life decreases. So that's what we're trying to focus on every day.
Absolutely. I think we're very fortunate to have something like the Wound Center in our community. What has the response from patients been like?
So our patients are like our family. They come back week to week. I see my patients 2 or 3 times a week sometimes. And when you spend so much time with these people, like, you really start to build that connection that other offices might not get to do because of like their care model might not allow for like week-to-week visits or weekly visits. So I really do think that our patients like build that trust and relationship with us, and I think that's where some of the compliance comes in. Like, I think they're more likely to be compliant when you have such a close bond like that. I know that our volumes and services have significantly increased since we've been open. So we've got many new providers, nursing staff, services that we offer. The Wound Center started in a small space in the hospital, and now we're in the professional building. So super cool to see the growth there.
You mentioned providers. Can you talk a little bit about the providers you have there at the Wound Center?
Yeah, so we have 2 nurse practitioners, Lisa Castor and Elizabeth Motes. And then we have Dr. Hallam, which is the vascular doctor. Dr. Candela, which is over in podiatry. He helps with anything on the foot and ankle part of things. And then, like I said, our nursing staff is pretty awesome. We have an ostomy nurse, and everybody works really well together there.
Do either of you have a success story that you'd like to share while we're on air?
Oh my goodness. What success story?
There's just so many. It's hard to pick just one.
Well, I know that there's one, Shelby, you can speak to it. Like, you started working with a patient that had severe lymphedema and edema. The patient wasn't really, kind of depressed, wasn't really getting up moving. By the time you were done, how much weight did the patient lose?
Yeah, they lost around 35 pounds.
Wow.
Yeah, so it's like people, like she said earlier, you have to celebrate the small successes, and it is really just one step at a time with some people. And I think that's, it is worth celebrating. You have to remind people of that, because they don't look at the, details that get overlooked to get to the bigger picture. I've had some breast cancer patients as well. I work with the breast cancer population, and I had one lady tell me that she no longer has pain when she drives or opens a car door. So it's just small things like that, you take for granted on a day-to-day basis, and then people come in and tell you these little small wins for themselves, and they're celebrating themselves, and it's just cool to see.
Absolutely.
I think I do want to add to that. So every year we try to pick a patient that has been a success story, and we call it our grand marshal for the race. So Janie, she'll take that patient on the golf cart, and she starts the race after they, blow the whistle to start, or before they as they are blowing the whistle to start. So we do try to feature one of our patients every year, and I think one that stands out quite a bit to me was that was our grand marshal, I think last year, a kiddo that had gotten burnt pretty bad while on vacation, really significant burns, had been other places, and I'm not saying we're a burn center by no means, but couldn't get to a burn center, and we were able to heal that that kiddo, and unfortunately the mother had burns, but she didn't initially tell us that. It just came out during the visit 'cause she was so focused, like we all are as moms, taking care of your child. And so that was a huge inspiration, and he comes back every year on his anniversary of healing, and just thanks the team and everything. So that was big, and that's something else that we need to feature too more, is like we take care of all walks of life. We've had infants all the way to 102-year-old patients. So
absolutely. And we've talked about MHP, and MHP has won several awards and that sort of thing. Can you talk about how unique it is for us to have this level of care in our rural community?
Wow. Yeah, I think that this wound center has been described as a center of excellence in central Indiana. And I think when you take us and you compare us to other wound centers around, like, you do have that all-inclusive package. And so we are very lucky, and we're lucky in the fact that we have the wound center and we have really great providers and team, but we've also been able to work with other surgeons within the hospital, like Dr. Christea for plastics. So a lot of times there may be a wound that we'll never be able to heal, but he can heal, but there's a lot of work that has to be done before we can get them to a surgery with him. We have to make sure the patient's healthy, the wound is clean, not infected, and there's just not I can't think of any other place besides downtown Indianapolis that has a plastic surgeon to pipeline these patients to. So we're so lucky here in Shelby County to have this. And I will tell you, each and every day, we're getting more patients coming in from outside the county where they don't have these services. So I'm really proud of the team that we have and the work that they do and the services that we've been able to build because of the support of administration.
Absolutely. So before we wrap up, can you remind everyone the date and location and how to register for the Healing Hustle?
Date is September 19th. Pre-registration is September 4th. You can register at www.mymhp.org/5K. I know the MHP Foundation page also has the link to sign up. There are flyers around with QR codes on it. So yeah, come out and have a great time.
Well, thank you both for being on air this morning.
We thank you, and we thank Johnny as well.
Glad to have you. Coming up, second half of Chamber Chat, and we'll take a look at the upcoming calendar on Giant FM.
When accidents happen, trust